As the national capital deals with the worst dengue outbreak in 5 years and with the death toll now at 21, Dr. Jyoti Kotwal, head of Department of Hematology at Sir Gangaram Hospital, is turning a citizen journalist. Here she is listing out the important do's and don'ts for prevention and cure of dengue. Akanksha Pradeep helped her file this report.
I'm Dr. Jyoti Kotwal, Head of Department of Hematology at the Sir Gangaram Hospital. I have turned citizen journalist today to help you all understand how to tackle dengue in this season. Dengue fever is caused by a virus which is spread by the Aedes aegypti mosquito. The symptoms of dengue fever are sudden onset of high-grade fever with severe headache, pain behind the eyes, back pain and joint pain. One-third of the patients with dengue fever develop dengue hemorrhagic fever, in which the platelet count is less than 1 lakh, and they can get symptoms of bleeding, and they also have symptoms of hemoconcentration, or they have a low serum albumin. It is these patients who have to be monitored regularly to decide whether they require platelet transfusion, and these are the patients who can go into dengue shock syndrome. We here at the Sir Gangaram Hospital are using a new parameter in platelets known as the IPF, or the immature platelet fraction, which along with low platelet counts is a very good indicator about how the platelets are going to behave in a patient with dengue hemorrhagic fever. If the IPF is high, and here we've got a cutoff of more than 10%, it means that in the next 24 to 48 hours, the platelets are going to come up. And these are the patients who may have to be just monitored and not require platelet transfusion. This is of great value because transfusion related infections are associated with blood products, and platelet is a blood product. Also, there is this issue of the cost of platelets. A single donor platelet costs around 20 to 25,000, and by just doing a simple cheap test of IPF, we can restrict the use of single donor platelets. Community participation and community awareness is very important because this mosquito breeds in small collections of fresh water in and around our houses. It is also important to do fumigation of the area where a patient of dengue has been detected, covering at least 300 meters around that area to kill the infected mosquitoes, and this is the responsibility of the civic authorities. This is citizen journalist Dr. Jyoti Kotwal for CNN IBN.